Tēnā koutou, tēnā koutou, tēnā koutou katoa. Welcome to this seminar on LGBTIQ Takatapui homelessness, or sorry, the other way around, to be given by Brodie Fraser, who has just completed her PhD in the Department of Public Health. She came to us having completed her first degree in politics at Victoria, and already with quite a strong activist profile, career, whatever. So I'd like to hand over to you, Brodie.
Kia ora, thank you. Thanks everyone for coming too. Lovely to see so many familiar faces. So yes, my PhD was on Takatapui LGBTIQ homelessness, and is this going to work for me? No. There we go. Just to start, I always like to acknowledge my participants and to thank them for trusting me with their stories. It was a really precious part of the research process to have people entrust me with such important and vulnerable stories, and I really hope that I can do them justice. And also, if you're not familiar with the terminology that I use Takatāpui and LGBTIQ. So Takatapui originally meant an intimate partner of the same sex, and through the work of one of our newest MPs, Elizabeth Kerekere, it's kind of come to mean more. It's used both as an identity for Māori who are gay, lesbian, bisexual, transgender, and it's also sometimes used as an umbrella term. It's just kind of up to people how they choose to use it. And then we've got LGBTIQ, which is lesbian, gay, bisexual, transgender, intersex, queer, and other sexual orientation and gender identity diversity. So there is nothing that we know in New Zealand about the topic, except for this research and another PhD student up at Auckland, Tycho Vandenberg. So I had to go to the international literature and figure out what was going on, and it wasn't particularly pretty. So the evidence said that 20 to 40% of homeless populations identified as queer, despite the queer population only being about 5 to 10% of the wider population. So there's a really, really, really massive overrepresentation in these stats. And queer people who are homeless face really high levels of issues such as substance abuse, family breakdown, foster care, poor mental health, sexual assault, all these other really quite bleak statistics, really. And so the literature kind of falls into three main categories, which I'll get into in a moment. And those are proximate causes of homelessness, early life systems failures, and experiences during homelessness. And we also see a lot that shelters and other housing providers are frequently really ill-equipped to work with LGBTIQ clients, and these spaces can be quite unsafe for them. So that's particularly in shelters that are streamed by gender, and they're often done based on a person's identity documents, which is very difficult to change, particularly in New Zealand at the moment. So sometimes people are ending up in the complete wrong shelters, and that's a very unsafe space for them. And even if they do get put in the right one, it's also can be unsafe as well. It just really depends. And there's just a big lack of safety for this community, really. So please excuse the graphics. I'm not a graphic designer, but this is what came out of the literature review. So I have charted the main themes in the lit review to kind of place them in relevance to LGBTIQ identity along here and homelessness along here. So our first group up here is proximate causes of homelessness, and those were most relevant to homelessness in general. They include issues such as poverty, mental illness, substance use, and racism. And hopefully you can see these arrows, some of them are bidirectional and some of them are single directional, which means, for instance, that they're two-way relationships, basically. And then this group here, we have systems failures in early life. So that includes issues such as discrimination, family relationships, foster care, and sexual abuse. And then where am I pointing? Anyway, the bottom one is experiences during homelessness, and those were most relevant to LGBTIQ identity, and that includes physical ill health and HIV, shelter and accessibility, and survival sex and sex work, which were quite common. So, what did I do for my PhD? There was a few different methodologies that I used. The main one was semi-structured interviews with 8 Takatāpui and LGBTIQ people who had experienced homelessness. Some of them, they'd experienced homelessness multiple times. Some of them, it was only once. I also attempted participatory video with my interviewees, and I'll get into that in a moment. And I also used the integrated data infrastructure to analyse the government service usage of women in a housing first cohort. And I know that's a mouthful, so if that doesn't make any sense to you, the IDI is a Stats New Zealand database, and it links together data from all different government departments, and it's all anonymised, and you have to have permission to go into the lab and that kind of thing. And one of our partners at He Kāinga Oranga, the People's Project up in Hamilton, are a really great housing first cohort provider, and they had a cohort of 390 people who really graciously let us put their data in the IDI, and we were able to look at their interactions with different government services. So because there's no LGBTIQ data in New Zealand yet, the census doesn't collect anything, we couldn't look at that for LGBTIQ people. So we decided instead to look at this cohort of women and see what their experiences are like. Obviously, because a lot of the people I interviewed were women, and some of the women in the Housing First cohort were LGBTIQ. And then I also used constructivist grounded theory to analyse the interview data, and it was also informed a little bit by the PV and the IDI data. So the interviews were kind of the main bulk of the PhD. And apologies, it's really hard to kind of condense a 20,000 word chapter into one slide. But this is kind of what came up. So the findings, I kind of put them into 3 overarching categories, and that was before homelessness, during homelessness, and after homelessness, but they weren't necessarily completely distinct. There was a bit of overlap between some of them. But we saw experiences such as pervasive instability and having to grow up fast, which were both really connected, particularly in childhood. So a lot of the participants were moving around a lot. They had parents in and out of different forms of employment, or parents who were self-employed. They changed schools a lot, that kind of thing. And as a result of that, a lot of them had to pick up really adult roles at quite a young age. And some of them left home at 14, 15, and kind of suddenly were in these really adult worlds, having to figure out how adults lived at a really young age. There was also a lot of difficulty in finding housing in the housing market, so overly stressed and competitive housing markets, people just with not enough money to get into those markets, discrimination in those markets, both anti-LGBTIQ discrimination, but also a lot of racism as well. And then we also saw systems failures resulting in a lack of autonomy. So for instance, housing systems weren't working properly, and people just had no choices, and they kind of ended up having to sleep on their friends' couches or couch surf and stay in sort of squats and places like that, which puts a strain on other relationships as well if you're just, sleeping on your friend's couch for 3 weeks kind of thing. And then during homelessness, we saw the necessity of strength of character of a lot of them, just kind of this recognition that nobody else was going to help them, so they just kind of had to do it themselves, and a lot of presenting a different self for acceptance. So that was both in relation to their LGBTIQ identity, but also in relation to having been homeless. So there was, and that came up as well, was that there was a lot of shame and stigma around both different aspects of that. So about their queer identity, but also particularly about having been homeless, and this kind of idea that they had to hide it from people. So a lot of them, this was the first time that they'd ever sort of talked about their experiences of being homeless. Nobody else had ever, they never shared that with anyone else. And then, so from that, we saw a lot of survival strategies such as sex work and theft and utilization of social networks and social media. And then a lot of them had to implement boundaries for self-protection. So that was particularly in relationship to their families. A lot of them had quite sort of chaotic, unstable family lives and just really had to put boundaries up with their family because they knew that that wasn't healthy for them and that wasn't going to help them maintain stability. Obviously, yeah, family relationship breakdown. And also, interestingly, there were multiple roles of religion. So religion was both a positive and a negative factor in people's lives. One participant in particular is a member of quite a progressive church and found accommodation that way when they were homeless, which was quite a lovely thing to hear about. And then after homelessness, we saw a lot the whole way through about stigma and shame. So a lot of hiding their identity and feeling like their sort of project of the self was a failure and internalizing these kind of neoliberal ideals of the fact that homelessness was a personal failing in their view and that was their fault and that was something they should be ashamed of rather than it being something that we should all be ashamed of, that it's something that we let happen and that continues to happen. You know, it's not necessarily an individual thing. And we also saw transgression of norms, particularly around flatting, and that was quite a hard thing for some people to kind of unlearn these sort of long-term habits that they picked up, and those kind of dynamics in flooding situations can be quite tricky, and that can kind of make housing unstable for people if they haven't experienced that in a while. And then a couple of them also expressed this desire to kind of turn their life around, and you know, they said, it's fine that I've been homeless and I'm moving on from that and I'm really proud of how I handled that, but I do just kind of want to live a more steady, kind of stable life and just kind of chill out a little bit. And something that was really special to me too was seeing how much they all supported other people. So I think just about all of the people I interviewed were really involved in their community, particularly in the LGBTIQ community, and were really active volunteers and really actively supported their friends and their whānau when they went through difficult times. And a few of them also mentioned to me that, you know, they were taking part in the research because they wanted to give back to other people and help other people who'd been in similar situations, which was pretty special to see, I think. So I think, yeah, the main takeaways from that, there's so many, but community connectedness really was a key disruptor of homelessness, particularly in the LGBTIQ community. That was a really, really strong part of people's lives. And people had really limited trust in institutions that were meant to support them. So for instance, some of the transgender and gender diverse participants talked about how, you know, they'd have a really bad experience with their doctor or a nurse or some healthcare provider, and that would just kind of shut them down, and they just didn't trust anybody else. You know, they were like, well, I'm not going to go to WINS. WINS aren't going to help me. I'm not going to go to the homeless shelter because that's not a safe space for me. You know, I just kind of have to figure things out on my own. And as a result, there was a really low level of engagement with social services. So I think maybe only 2 of them had ever approached a shelter, and neither of them had particularly good experiences. And I think one of them didn't stay, and one of them only stayed kind of a night in a shelter. So it was very much just figuring things out on their own and finding support and housing on their own. Sorry, this is all a lot to take in, but moving on. So yes, I attempted participatory video, and I had these beautiful grand ideas that the aim of it was to allow my participants to be co-producers of knowledge, and they would be in partnership with me. And what we would do is I would bring my participants together and I would facilitate the day, but they would make videos about their experiences, particularly what they wanted from service providers. And the dream was that we would take them to the service providers and say, here you go, this is what we need to do. But that didn't work. PhDs never go to plan. So I spent, I think, about 4 or 5 months trying to just schedule our first video session. It was a nightmare. And so a lot of participants dropped out, and people were really involved in their activist communities. So they had no time, or they were working multiple jobs, or people were working jobs at night. Some of them working jobs during the day. Some of them didn't have childcare, and it just did not work. I think everybody was still kind of trying to get some economic stability in their lives, so that they just didn't have time for this project, and that's okay. So I got 2 people to come along to the first session, and then 1 to the second session, if that's okay. And the participants who did attend, interestingly, were both upper middle class, and I think they were both very switched on. I mean, all of my participants were, but these 2 were particularly eloquent and particularly able to express themselves and were comfortable in that environment and kind of speaking about these things publicly. And I think this really spoke to the fact that, I mean, I think things are changing ever so slightly now, but when I did this, there was just nobody talking about the topic in New Zealand. And it is a really scary thing to ask people to sit in a room with a bunch of strangers and talk about some of their most personal experiences on camera and then show those videos potentially to other people. And just the really stigmatized nature of both of those things, I think, is why that didn't work out. So one day in the future, maybe it would be lovely to do a project like this, but I think at the moment we're just not ready for that. And there's still so much shame and stigma around both of these things that just didn't work, but that's okay. We did learn a lot from it, which I think is useful anyway. And I also use the IDI, as I mentioned. So these are just some stats about women's homelessness that are relevant as well. So there were 390 Housing First clients, and of those, over half were women. And then of the women, most of them, the high proportions of them were Māori, 81.4% of them were mothers, and 57.1% of them were aged 25 to 44. So overall, the women were more likely to be young, Māori and mums. And I think a high proportion of them had more than 4 children in comparison to the men as well. So they had quite a few kids as well. And we were able to compare the women in this group to the men in the group, but also to a control group of women in the estimated resident population, the ERP. And what we saw was that women in the cohort were 3.5 times more likely to be hospitalized, and they had 4.3 times as many maternity hospitalizations. So that was quite a big part of their experiences. And then, I mean, it wasn't incredibly surprising, but still a little bit shocking, I guess, was that women in the Housing First cohort had considerably lower incomes than both the Housing First men and the ERP women, and they had much, much higher benefit receipt than the Housing First men and the ERP women. And we can kind of break that down as well into different benefit types. So the women were much more likely to be receiving a sole parent benefit, and the men were much more likely to be on a job seeker benefit. And I'm sure, as we know from the WEAG recommendations, is that benefit rates in New Zealand are very, very low and need to be raised. So that's just a really key thing I think we can do to support these women. And yeah, interesting to kind of think about that in relation to how that intersects with LGBTIQ identity. So particularly if these, you know, are young women and they're Māori and then maybe they're queer as well, there's kind of all these different things interconnecting that can kind of not always necessarily go wrong, but sometimes mean they drop through the cracks and aren't getting the support that they need. So this is my grounded theory. This is what I spent 3 years working towards. And what I came up with was that experiences of Takatapui and LGBTIQ homelessness are shaped by multiple failures of support and intervention points, the necessity of survival restricting choice and agency, and the long-term effect of concealing identities and having to cope with shame, stigma, and trauma. And understanding experiences of Takatapui homelessness really demands that we focus on and across systems and institutions rather than just the individual and fixing their unique problems one by one. It's kind of, we need to kind of go up a bit more and think a little bit higher about it. And I know there's a few policy people in the room as well, and other researchers and service providers. So I have some recommendations for you all. Don't worry. So the main thing I think that we need to start off with is that we really need census to collect comprehensive data on these communities. James Shaw did promise that the 2023 census we'd get it, so I'm hoping, fingers crossed, we'll get there. And then eventually that can go in the IDI and we can figure out how big the problem is, you know, because we don't really know anything about it. So that's really important. And we really do need specific government policy and strategy aimed at addressing the problem with clear accountability measures to ensure that they're being acted upon. And I know that the Homelessness Action Plan has kind of mentioned LGBTIQ communities, which is a fantastic start. And obviously we need funding for targeted LGBTIQ homelessness services, and specifically I think government contracts should go to providers that we need some kind of standard for providers to meet to ensure that they've got the competency to provide appropriate services for this group, and specific programs need to be established for them as well. Another thing that was really important is that WINs really need to have greater flexibility for individual circumstances. And I think this is a problem right across the benefit system. It's not unique just to LGBTIQ people, but you know, for example, one of my participants left home when they were 14 because things were a bit chaotic and unstable, and that was the best choice for them to make. And they tried to get on a benefit, an independent youth benefit, I think it was called at the time. And WIN said, well, we need confirmation from both of your parents that you can't live at home. And they said, well, okay, I don't know where my dad is, so that's not going to happen. And they're from a Māori family, and their mum just absolutely was not willing to say that they couldn't live at home because she didn't want her other kids to be taken off her by oranga tamariki, which is a very real fear. And so this participant said, well, Mum, what if I just say that I'm violent towards you, and that way I'm the problem and they won't take my siblings off you? And, you know, that's, no mother wants to say that about their kids, right? And then WIN said, well, if we do give you the money, we need to contact your mum and check that you're not just going to waste all the money. And as my participant rightly said, you know, what if my mother was abusive and just lied and said, oh no, this kid's really irresponsible with money, don't help them. So they didn't get a benefit, and they tried to go to one of the local social services that gave out food parcels, and they said, well, we need your WINS number. We can't give you this food box until you give us your WINS number. And they said, well, I don't have one. And the organization said, okay, well, give us your address so we'll drop something off to you. And they were like, well, I'm homeless, I don't have an address. Like, can I just take the box now and take it with me? And it was just kind of this big cycle of things not working out. And they just kind of gave up and said, you know, I'll figure things out on my own. So they really, and you know, that's not a unique story, I don't think. I think this happens to quite a few people, is that there's just completely inflexible criteria and people just kind of go chasing around in circles and don't get the support that they need. And obviously it would be really lovely to see the new government implement the WEAG recommendations, particularly around raising benefit levels, and that will help the LGBTIQ community, but that will help, I think, all of our poorest New Zealanders. And then just a few kind of nerdier ones, strengthening the BORA, the Bill of Rights Act, which Geoffrey Palmer wrote the bill, and even he says that it needs strengthening. And then amending the Births, Deaths, Marriages, Relationships Registration Bill, that one's a mouthful, so that identification documents can be amended. So this was going through Parliament with the last Labour government that we just had, and basically what it means is that at the moment, if you're transgender or gender diverse and you want to change your birth certificate to have the right sex markers on it, at the moment you have to either go through medical processes, which are really inaccessible in New Zealand because they're underfunded and not all people want to go through gender reassignment surgery, or you have to go through the family court, which is a really horrible process. And I had a friend go through it recently and said, you know, she said her whole life was laid to bear on court and on public documents, and she just really had to prove that, you know, she was a woman to get her documents updated. So there's a push to get it to just be self-identification, so a person can just tick a box and say, yep, I'd like it changed, please. This is how I identify. But Tracy Martin slowed that one down. So hopefully now, fingers crossed, maybe that will be brought up again. But I think that's a very easy thing that we can do to help people. Research-wise, I've also got a few ideas. So qualitative research about homelessness service providers and routes into and out of homelessness, I think would be important to look at a bit more in detail. And I mentioned earlier with the IDI, it would be really good to get some quantitative research about the prevalence and the demographics and government service usage of Takatapui and LGBTIQ people who've been homeless. And also, I think really specific qualitative research about both transgender and Māori specific experiences of homelessness would be quite useful. So I know that up at Auckland University, Tycho Vanderberg's doing a PhD on transgender and gender diverse experience of homelessness, which I'm very much looking forward to reading. And then further qualitative research about broader experiences of flatting and boarding houses, emergency accommodations, shelters, and those kind of things I think would be quite useful and interesting as well. And some kaupapa Māori research about Takatapui homelessness would be really fantastic. And then, of course, we need funding to do all of this. And finally, for service provision, I think this is a really important thing that we need to address as well. So at the moment, we don't have any New Zealand kind of best practice on how to, provide competent support for LGBTIQ communities. It's the rainbow tick, but I am not a fan. That's okay. So I know that Rainbow Youth are currently working with some of the providers up in Auckland to develop something. So hopefully we can maybe potentially roll that out across the country. But in the meantime, there are a lot of really great international examples. True Colours United are, I think, New York based, and they have a lot of really great free resources about providing good support for LGBTIQ clients. And so more specifically, staff need to receive regular and thorough training, not just kind of like a 1 hour workshop, maybe once every sort of 5 years, that's not quite going to cut it. And they need to make their spaces visually accepting, but they also need to move beyond that. And they need to have forms that reflect gender diversity, which actually is a bit of a problem. I know a lot of you are probably medical specialists and stuff, but I think the software that you use in doctors and stuff is quite difficult. So that only has male and female options. And then if somebody is marked down as being a female, they're going to get reminders for things like pap smears. And if they're marked down as male, they're going to get reminders for things like prostate exams. But if you're trans, that's just completely wrong, and you're going to miss out on getting those important things. So even just things like the software need changing as well. So there's a lot to do. Gender neutral toilets are a really easy and important thing to do, using a person's chosen name rather than their dead name. So for trans and gender diverse people, their dead name is what their parents might have given them when they were born. And a lot of people rightfully don't like to use those. And if services are streamed by gender, allow a person to choose which service they're using rather than basing it on their identity documents, because those are quite often out of date and cost a fortune. You have to go through court, nightmare. And then finally, I think specific housing placements need to be made available for Takatapui and LGBTIQ people. And I'd also be really interested in He Kāinga Oranga potentially including that as a factor when they're assessing eligibility for Housing New Zealand. That's something that a few of my participants said, they tried to get on the wait list. One in particular, had a disabled child and was trying to get on the Housing New Zealand wait list. And it just, they were like, well, who cares, even though this person was trans and very much discriminated against in the housing market, and it was just impossible for them to get anything. So those are kind of the main things that need to be doing, but obviously that's the start, and it's very hard to condense a PhD into sort of 30 minutes. But I've left my email address here if you need it, and I think we've got time for some questions. That's okay. I like straightforward.
I'm curious to know what age range you spoke to and how you found your participants.
Mm-hmm. Yeah, so I spoke to people, I think probably aged about sort of 27 to their 70s. So it was a really broad range of ages, and people were reflecting on all different parts of their lives. So for some of them, it had been when they were teenagers, some of them it was just kind of, cycles in and out throughout their whole life. And I did make a conscious decision when I was recruiting my participants. So yeah, my background was political science and queer activism. So I didn't have connections with housing providers, and we kind of kept it that way while I was recruiting, because we wanted to find people who maybe hadn't engaged in services and to figure out why that was and what their experiences were like. So a lot of it was social media and word of mouth and some queer organisations and sort of posters around town.
That was super interesting.
Thank you.
So I just wondered if you collected any information about the influence of school, like I guess looking back, where did it start? Where did the negative impact start that got them to that place? Was it school? Was it younger? Was it a mixture? Because schools vary a lot, I've discovered recently.
Yeah. So a couple of them had become homeless when they were teenagers. And I think it was a combination of kind of school life, growing up. A lot of them grew up in really rural areas that where maybe they were the sort of only queer or trans person around, and so they kind of fled to Auckland or Wellington, to bigger cities, or some of them got kicked out by their parents. Some of them, home life just was stressful and chaotic, and that wasn't what they wanted. And that was just for the ones who became homeless in their teens, but others, it was all sorts of things. So schools, did have a bit to play, I think.
Kia ora, Brodie, thank you. How wide was the geographic spread of your participants?
Yeah, so everyone I interviewed was currently based in Wellington. That's where I am, but they'd been all around the country, so a lot up in Auckland, some in rural North Island, Wellington, Christchurch, Nelson, I think as far south as Dunedin, so kind of all over the country.
Hi, Brodie. Thank you. What's your opinion on youth foyers, specific LGBTQ youth foyers that are for the needs of those communities? Do you have a take on those?
So like specific youth programs?
Yeah, I'm thinking like the youth foyers that are currently in construction in Christchurch, where it's kind of like a co-housing situation where you have that wraparound social support on site for young people, and it might be more targeted. There might be more access for different kinds of communities. What do you think about
Totally.
those?
No, I think that's a good idea. And I think, so it was young people, but it was also adults. And I think we kind of need support across that whole spectrum. It's very easy to just kind of focus just in on youth, who've been kicked out of home. But obviously these experiences are a lot wider than that. So we need to kind of have things that go across all different age groups, I think is really important. But wraparound support is very useful.
Good, Brodie, that was awesome.
Thank you.
What are your reflections on how being homeless impacted on the evolution of identity as opposed to people who are non-homeless and the evolution of their identity?
Oh, interesting question. I like it. I think it definitely was a big part, like it shaped a lot of people's lives, their experience of being homeless. And I think particularly when you think about the shame and the stigma that people have influenced, a lot of them still just were dealing with a lot of like low self-esteem and shame. And, when I was trying to organize the video sessions, I had an email from one person saying, sorry, I'm not comfortable doing this. Like our interview was the first time I ever talked about this, and it kind of made me reflect on like the gross things that I'd done, which is totally not how I'd interpreted their stories. I was like, wow, your story really was one of like a lot of strength and kind of these amazing survival strategies, and like that's not how I would view it at all. So I think there was a lot of people internalizing all this shame and kind of feeling like they'd sort of failed because they'd become homeless, and their life wasn't as good or as proper as other people's, I guess, which is not how I view it. It's more, for me, it's more that we've kind of failed, that we've let people become homeless and end up in these really poor situations.
Hi, I'm David. You seem to have described individuals. Did you interview or meet with any partnerships, couples, where homeless people were more than one?
No, but so one of the people I spoke about had been homeless as a teen, but also been homeless with their child later as an adult. But for the most part, they were all single when I was when they were homeless. One of them kind of found another group of other gay and transgender and bisexual people in Christchurch who were homeless, and kind of they banded together, and this person advocated for them all at WINS and got them all into one house and got them all emergency food grants, and which was really beautiful to see. But yeah, for the most part, they were on their own. I think it does happen. I think that's probably more common in families when families become homeless. Yeah.
Yes, I was wondering, just a question for me, Brodie. What did you think about people's aspirations once they'd managed to get back into a position where they were housed?
Yeah, I mean, I don't think I delved enough into that, and you know, there's all these other things that I want to talk to people about. But I think some of them were pretty basic. You know, they just wanted a stable life, and they just wanted a house that they could live in for a long period of time. You know, rather than constantly rents rising and landlords kicking them out and that kind of thing. And yeah, so just a bit more stability and kind of being able to let go of those stresses of, you know, some of them would said that she hoarded a lot of sort of like long shelf life food and freeze-dried meals, just because, you know, there was this constant panic of, well, what if something goes wrong? Even though she was working a full-time job on quite a decent sort of salary, there was still that sort of base level fear and stress kind of. So I think it was, yeah, a desire to move away from that.
Kia ora, Brodie. Oh, that was really great. Sorry, I'm getting a lot of echo here. I was curious about your recommendation for policy where you are suggesting that the Bill of Rights needs to be strengthened. And I wondered if you wanted to comment on any particular aspects there.
No, I just think in general, there's probably, I think it kind of needs to be strengthened in the sense that it can kind of, you know, I think Jeffrey Palmer's probably talked about it a lot better than I could. I'm not a legal scholar, but just kind of strengthening it so that it's not quite as easy for Parliament to just kind of create bills that overturn it. Like if you look at prisoner voting rights, you know, they were able to do that even though that's been found to be inconsistent with BORA. So just things like that, making sure that Parliament can't kind of just be like, oh no, we'll just do what we want. We've got a majority. It's fine. I mean, it's not quite that simple, but yes.
I'm Labine. I work here in the Department of Public Health. Thanks, Brodie. That was amazing. In terms of ethnicity and socioeconomic levels, did you notice anything in particular there?
So I think I had 2 Māori participants. One was an African immigrant, and I can't go any, I know that's very broad. Africa's a very large continent, but that kind of ruins the anonymity of it. And the rest were Pākehā. But class-wise, it was a real big mix. So some of them were sort of upper middle class, private school educated, like reasonably well-off families. Some of them were just sort of comfortably middle class, and then some of them were very working class, you know, parents with kind of no sort of formal education beyond high school. So it was a really big mix, I think, which was quite interesting, and kind of, I think that's where LGBTIQ identity played a big factor, and particularly transphobia and that kind of thing.
I think I'll just ask you one more question about class, which I don't think we've particularly. Sorry, I'm one of Brodie's supervisors.
It's like supervision, but public.
So when we think about class, what do you think about the outcomes, and how much support were people from backgrounds where there were resources able to get from their families once they got?
So I think for some of them, particularly the ones who were more sort of upper middle class, had families that were potentially had the capacity to be a bit more engaged. So one of them in particular struggled with addiction quite a lot and comes from a family of doctors. So had their siblings kind of sit them down and say, right, well, we know exactly how to get you the addictions treatment that you need. So this is what we're going to do. I'm going to take you hand in hand to the doctor. We're going to go here, we're going to do that. And I think that was quite a big support for them. Whereas you saw there was on the other end of that, another participant who came from a very working class family and also had addictions, and the way that they got sober was through moving in with somebody they met at their dealer's house who became their partner and said, you know, sex work is really tiring, let's both just get on the methadone program. So they did that and they didn't have to work as much. And then she kind of decided, well, this isn't working for me, and just kind of weaned herself off methadone. And that's how she became sober. So really different kind of levels of support there and knowing the systems and that kind of thing.
Okay, well, any more questions?
No.
And that is, you know, in this kind of research, what is considered the strengths numerically to generalize to the wider population when you have 8 participants?
Yeah, so I think it's more kind of, this was about not so much being able to say, well, this applies to everyone, because it is 8 people and it doesn't, but more kind of starting from a place where we don't know anything and saying, well, what's going on? What are these experiences like? What can they be like? And getting that grounded theory is making sure that what we do know about it is really, really based in people's lived experiences. So it's not just me kind of sitting around going, well, this is what I think is going on, but it's reflecting on people's experiences and saying that's what's going on based on that kind of part of it.
Okay, I think that's a great question to end on. The strengths of qualitative research, and what I think Brodie hasn't really told us, or she summarised very briefly for us at the beginning, is how much of her PhD was involved in activism and trying to find out ways to get more data in the future and to improve the data that will be available, so we can actually use it to get out there and provide effective support for that really overly represented group of homeless people, Takatapui, LGBTIQ+. And it was a great pleasure to be able to supervise Brodie, and I'm sure Ali, who's also sitting in the audience, and Neville, who unfortunately wasn't able to come today, would say that also. So let's thank Brodie, and thank you.